So, Griselle, what areas of tightness are you seeing people challenged with, especially now that people are doing so much work on Zoom? What's different now?
Hi. So definitely within the past few months since I've been open, I've noticed a lot more tension in the upper back, particularly in this region, from all the computer work, and low back hips.
So, if somebody's sitting at their desk or wherever they work from, people are using makeshift spaces and furniture these days to work from home. Um, what can they do if they happen to notice that they're having a lot of tension up in this neck, shoulders area? Where would you suggest somebody might start being able to work on themselves?
So the first place I recommend to start is right in front of the neck, only particularly because even though we feel the pain in the back, we don't realize how much tension is being pulled forward, causing the pain. So the muscle we're going to first start with is called the SCM. And so if you start feeling, on the side of your neck, you're going to start feeling like almost like a rope. And it might feel tender, it might feel tight. And we want to pull both sides just to feel which one is tighter. So we worked on my left one yesterday. I'm going to stay with my right one today.
Can I work on both at the same time?
You probably want to stay with just one side just because you want to know which side is referring pain to other parts of the body. So there's trigger points that can be located in the muscle, which would then radiate pain to other parts of the body. And in order to release them, you have to know where they're coming from. So it's good to work one thing at a time.
And we're kind of starting towards the top, kind of like at the top of the jaw, is that right? And
yeah, so the muscle starts at the edge of the ear. So we're going to take our 3 fingers, the middle pointer, index, and we're going to start right where you feel that bump at the edge of the ear. You can feel that muscle kind of crawl all the way up. And another, suggestion would be, or pointer is, you'll feel the how good it feels just by massaging that area. And so you can start by just doing some smooth, just circular motions, gliding it up towards that point that you're feeling. Sometimes if you feel some tenderness, you can hold it there. So we don't want to force it. You can just do a nice hold. And so what's important when you do these things is to have good posture, to be somewhere where you're sitting properly, and to be open so you can get a good breath in. So we're not going to we're not going to get a deep breath right away. You're going to start right at the diaphragm, just being aware of your breath. And as you expand, the breath will get deeper and more relaxed.
that was a good reminder for me to not collapse back into my chair. Even though I'm sitting in a relatively straight office chair, I did find myself kind of caving in a little bit. So good reminder for me to sit forward and more on the edge of my seat. And I am feeling a lot of relief as I rub that area right below the ear and kind of the top of the jawbone.
Yeah, and just a reminder, it is part of the jawbone. So if you do have like TMJ dysfunction, you can really hold a spot there and just play with opening the jaw nice and slowly, closing it. See if you get any changes or reliefs, because everything is connected. You're going to feel it in different parts of the body, and you'd be surprised where you feel it. So yeah, as I'm opening my mouth nice and slowly, I feel it just, being right at that point where my fingers are at. And like I said, you can play around, find it, feel around the ear, because any tissue that surrounds the muscle can be affected, especially with all the tension that we're getting in this upper region.
So then do we want to start working down from that area at the top of the jaw, down the neck?
Yes. So you're feeling for that ropiness. And what you do is you're pulling the muscle. So the skin, you're not pulling necessarily just the skin, you're grabbing the muscle and kind of giving it a little bit of a tug. So right now I'm actually feeling a point that's traveling a little bit towards the back of my neck. Sometimes, so like I said, trigger points are places that refer sensations or pain to other parts of the body. If you feel that, stay in that location. Remember good posture and good breathing, and you can hold it up to a minute or so to see if there's any changes, if it diminishes, if you feel release. If not, it just shows how much tension we have, and we just keep working it and working it until the pain lessens or until we can feel the release.
So it's interesting because I'm doing my left side of my neck, and I am feeling a response over here on my right jaw.
Yeah, very good. Yeah, that definitely happens, and it's not a surprise. So if you feel that, it's, you know, just the awareness comes to you, and it's good. So when you get a massage, you're not surprised that pain can travel or sensations can go in any part of the body.
And the pain can be from a release.
So sometimes you do experience that like first sensation of a pain. There is a difference. Now, if it's causing like a shooting sensation, almost like a nerve sensation, we want to get off, take a break, take a deep breath, and then go back and see if there's something else you can feel. You
So
know, sometimes
a signal that we want to pay attention to, that maybe we're doing too much, or maybe there's an injury underlying or something like that.
correct. Yes. And that's where, you know, we would consult a professional, whether it's a massage therapist, or if we figure we have other issues, you know, there's other professionals to consult.
So how far down do we go with this pulling of the muscle on the side of the neck?
So you can feel it, and it goes all the way down to our clavicle. And the closer you get to it, you might even feel like pulling and a good deep stretch from the lower muscles, which is the pec, and then the muscles that connect into the shoulder. So yeah, that feels really nice.
And it feels different. The sensation feels different as I go down.
Yes. Yeah. And you can even do a little bit more of like pulling here, just because the muscle is, so there's a lot of nerves, a lot of tissue connected here. If everything is stuck, it might make breathing a little bit difficult too. We may not realize that. But a little bit of tugging, you might feel a little bit of like a burning. That's just the fascia. Again, if we hear or feel like a nerve sensation, then we have to, like, you know, relax, take a break, and see what's going on. And if it happens again, then maybe we should, you know, stop that and consult a professional to see why that's happening. And, you know, hopefully with the pandemic cooling down, we can get an actual massage.
So we get down to this clavicle area, and then we keep working down.
Yes. So my favorite part is working the sternum. So the sternum is right in the center of our rib cage. We can get right to the clavicle and just, again, good posture. Yeah, good posture.
The collarbone.
Yes, the collarbone, which is the clavicle. And if you feel right under it, you might even feel a little bit of tenderness, a little bit of good pressure, like, oh, there's something there, some tightness. And if you find a good point where you're like, oh, that really feels like a deep tension, then this is where we can bring in some stretching into this type of work. And I always like stretching the pec, especially if we're always on a computer or driving, or most of us just hold our tension up in here, but it's mostly felt in the back. So remember, any pain that we feel in the back can most of the time be because of all the tension we feel up in the chest, pec, and neck area.
I carry so much tension in this area that sometimes it is tender. So I don't just feel it at the back, I get it in the front as well. Like, it is tender to the touch right here. And that's,
yeah, so we're
on that right now, right?
Yeah, so with tender areas, if it's too tender to stretch, and if we can't even stretch this far because of range of motion, just do a little bit of a shoulder movement. It doesn't have to be too much. If it's too tender to even stretch, just even breathing into it for the first 30 seconds to a minute is good. You'll feel it with time, it just releasing on its own. And then if you can stretch with it, you'll really feel the difference afterwards, how much lighter, how much looser it feels. And I'm just moving my fingers closer and closer to the sternum. And then when you're done with that, you can move down a rib. So you'll feel the rib, you'll feel where that is. And right below it, you'll feel more muscle and more tenderness. Also, if it is difficult for range of motion, also due to tenderness, exhaling, so taking a deep breath, and then exhale as you do the motion also helps, because exhaling helps with that force. And it just feels good to go there, and we can just go to the rest of the chest, up the pec, closer to the shoulder joint. And there's just a lot of different points you can stick to. You can probably be in your chest area, the upper chest, for probably 20 minutes, good 20 minutes, just releasing one side.
Given what I'm feeling in there, I think I could easily do 20 minutes. So let's talk about the two sides, because so far we've only been working the one side. My experience as a student of yoga is that we tend to want to do things symmetrically. So if we do the left, we want to do the right. For your purposes, in terms of this kind of muscle release, what do you recommend? Just work like the problem side? Or do we want to try to do both sides and make sure that we're sort of balancing ourselves out?
So yes, I definitely agree with balancing out, but there's a different ratio versus yoga. So, I mean, I guess with yoga, you can do a deeper stretch on one side versus the other, but the area that causes more tension, that you can feel more tightness up in the SCM and into our collarbone, that's the side you want to spend more time on. So if you're doing, let's say 30 minutes total, or even just 10 minutes, you want to do about 6 to 7 minutes on one side, and then spend a couple minutes on the other side. Because yes, we're going to feel tension. Yes, we're going to feel, some tenderness. But I think the side that bothers us more has more knots and more trigger points. So once that's released, the next time you come back to doing this, let's say the next day or the next week, you can reverse it and work your more stronger side and deeper side. Because sometimes by releasing the weaker side and not releasing the stronger side as much, then it's going to cause similar issues, but in a different way. So you want to ratio it, but in different sessions.
Okay. So one of the things that you just said there is we can vary the length of time we spend total, depending on how much time we have. So this doesn't require 20 minutes per side, which a lot of us wouldn't have a lot of the time, right? If we've got 10 minutes, we could do 7 minutes on the tighter side and then 3 minutes on the other side. And
yes,
if, let's say we're like really pressed for time, like how long is the shortest amount of time you would say we could spend working this area, the pecs, clavicle?
So if we're really tight on time and we really want to actually get this whole area, I would say at least 3 to 5 minutes on just like pulling and holding. So what I would recommend then is just literally finding tender spots, taking a good posture, breathing into it for at least 20 seconds, and then move on. If we feel like we have to pull this or hold it for 5 to 20 seconds, move on. So each segment that you're holding onto can be about 20 seconds or so. And the important thing is to breathe into it, to hold, to really be calm and set the intention of releasing that area. Because if you get into the tender points, after 30 seconds, that's when they should technically start releasing. It just depends on how much tension we're actually holding. So each person holds a different amount of tension on their body.
Okay. So we need to be thinking about how tight we are and where we're tight. And we kind of like factor in how much time we have to devote to this process of trying to unkink our muscles.
Yeah, absolutely. Another easy thing to do if you're really just pressed on time is just, doing arm circles just to feel the tension. We could even just put one hand over one other side and just like stretch it open. This kind of stretches like the shoulder joint itself. It doesn't necessarily get deep, but you can just like, just a quick press, and remember breathing in, exhaling, breathing and exhaling just to get that open. That's a good area. It's always nice to pin the muscle and then to stretch. So like if I want to do a neck stretch, I always like pinning the shoulder down versus just going into the stretch itself. Because then any muscle that you're feeling connected to the shoulder from the neck, by holding one side, you're able to at least get a different type of stretch versus just, forcing it over and maybe not stretching the right areas.
I just learned something. So I carry a lot of tension in the back of my neck. And that is especially true with all the Zooms. Can you run us through this thing that I just recently learned and have been using a lot, the chin tuck?
Awesome. Yeah, so the chin tuck is one of those things as therapists and professionals that we totally forget because we do it all the time. So it's second nature for us. What it essentially is you're basically tucking your chin into your body and making your spine closer towards the back. So obviously we have a curve in our spine, and it's just bringing it back. And so it feels weird. It may feel good. It may feel different just because of how our posture is. So if we realize that we create pain by doing it, then maybe we should seek a professional to see what is causing the pain. There might be a misalignment. So the chin tuck, to do it best would be on a firm surface if you're lying down or on the wall, just to make sure that you're doing it properly. You're not tucking your chin outward or tucking your chin where your neck is actually being forced back. You really just literally want to go tuck backwards, and just to get a side view.
Thank you.
So it might not seem much,
Mm-hmm.
but as you can see, just a little movement in my neck as I'm going back.
Yeah.
And
I found this one to be hugely applicable and versatile and easy to integrate into my life. I can do it anywhere, anytime. It's so subtle that nobody can tell I'm doing it. So, I could be waiting in line at the grocery store, and I can do it and nobody knows. I could be driving. I could be, on a Zoom, and it provides me with instant relief. It's really cool.
awesome. Yeah. And the other thing, I always bring this back because even when I do a massage, I have to give like 20 reminders about breathing properly. The best way to do this is as soon as you're about to exhale, bring your chin back. You don't want to be stuck in the middle of a breath because that can be another reason why it might feel different or weird. So it's always in the exhale that you want to create the movement.
Okay. Again, I just learned something. Even though I've been doing the chin tuck, I was not taught how to breathe when I do the chin tuck. So I just learned something more. So you said that there's a lot going on with people's neck and shoulders, a lot going on with people's chest areas, having a lot to do with the fact that we're, leaning over our computers a lot. You also said that during the pandemic, you're seeing more hip and low back tightness. So talk to us about why that might be, like why would that have changed, and what can we do about it?
So definitely the number one reason why it's been a bigger issue is one, we're not in our normal environment for work. So we had to readjust being at home. We may not have the proper seating, the proper environment for our workspace. And then everything is mixed in together, work, home, and there isn't any divide between work and home space. So then a lot of stress can be held in the hips or in the upper body. And so hips is that second area that I've noticed more tension, more tightness. And a lot of it is in the hip flexors because we're sitting a lot more. Since we don't have to travel, a lot of people are actually working more at home, just being at home. Another reason could be, or that is that, the motivation, the lack of motivation to even work out, to move, to get up, that's definitely gone down since the pandemic. And, I can see why.
And it's not just the access to gyms that we're lacking. There's a motivational component, which is, from my standpoint as a psychologist, extremely important. And working with somebody like you as a coach could help kind of get into some kind of routine, rhythm, increase your sense of motivation, I'm guessing.
Yeah, absolutely. I think just having someone else there to, to give you information, to be a guidance, a coach, can always make things a lot easier and a lot more, aspiring to do.
So show us what we can do. Again, we're thinking about what's quick and easy and that we can kind of do in the middle of a busy work day, busy work week. We notice that we're tight in our hip area or low back. What can we do to release it?
So one of the big stretches that I like to go to right away is the hip flexor stretch, and there's two different ways of doing it. There's one where you have your leg on a chair or table, and one that you can do on the ground. So I want to start with the one that you can do on the ground. So you're going to be standing up actually. I'm just going to move this down so we can see better, hopefully. So what I'm going to do is go into like a split stance. And whenever you do any stretches, make sure that the hips are posteriorly rotated. So what that means is you're going to tighten your glutes. You're going to bring your hips closer to your spine, and you want to contract the abs. So bring that area towards the spine too. You always want to contract the abs and the glutes, because then you're going to feel that stretch more even deeper. So once you do that,
effect, right? We're tucking.
yes, we're tucking in, correct. So even just by the act of tucking and the act of contracting the glutes, I already feel the stretch. So what you're going to do is you can bend that forward knee, making sure you're still bringing that, you're not going forward into it, you're still tucking, you're still contracting the glutes, and you're just bring the arm up. And the more you bring your arm up, you're going to feel that stretch go all the way down, maybe down to the knee. And just remember to be firm on the ground. So that's one way of doing it. Make sure to not overdo it. Just feel where you feel that stretch as far as you can go. You can even do a little bit of a bend, like a bend towards the leg that is bent as well.
What's bending?
Now, so bend, lateral bend is going side bend. So
Okay.
going from this angle,
Got it.
I'm just going to my side. Yeah.
Yeah. Okay.
So that's one
Not
stretch.
a deep lunge.
Yeah. And the other variation that I like better is the with a chair or with a table of sorts. So I'm going to use my massage chair since most people have chairs. And the reason I like this better is I can feel the bend better. And for people that may have like knee pains, it might feel better just because you're not, using the floor a lot. So I have my foot at the edge of a chair right here. So same concept, the glutes are tucked in, or tighten, the pelvis is rotated back. And then the front leg, I'm bending in. And again, you can bring that arm forward. If you want to put the feet up like that, that works too. And I feel that stretch more in my quad, but there is a muscle in the front of the thigh that connects to the front of the hip. And so that is one thing you can do to help release any of the tension that we're feeling in our hips. Now, again, there's other things that might be going on in the hips that causes the tension, but what I'm trying to state is that from all the sitting, this is the muscle that gets tight the most.
Yeah. So, right. So you're saying we don't want to just necessarily assume that if somebody's got hip tightness, it's just something that they can work out themselves. There might be some situations in which they need to see, say, a physician to get x-rays or something like that. If it really seems like it's kind of stuck. That's what was the case with my hips when I had undiagnosed arthritis in my hips.
Yeah, I definitely think that I would always first go to the first step of, the first step for me would be like, I'm going to receive a massage. And first, if all health as well, if your physician recommends a massage for you, that's the first thing I would receive. Now, if there's deeper issues from like some type of injuries or it's causing so much pain or nerve sensation, then yes, I definitely would go straight to a physician to see like if there's any MRI and indications that would deem like surgery of sorts. But there's always steps to take before we get to that point.
Yeah. So we've talked about things that we can do in the middle of the day quickly if we need to release tension. The things that we just talked about, might somebody make those kinds of stretches or exercises part of their morning routine?
Absolutely. I definitely recommend before you start the day to stretch the muscles that throughout the day we tend to tighten, which is the hips and the upper region of the body.
Okay, so you could basically take these same exercises and create a morning routine for yourself, which might set you up to have less tension in the course of the day?
Well, it depends, on your day and how much tension we end up getting. There can be some news and not realize what happens. But yes, I do believe that releasing a little bit, it won't make it more tight throughout the day. Again, sometimes we may not even realize how tight it is until we start working on it. So
Yeah.
if we do little by little each day, it'll feel different each day, and you might feel the pain from the back diminish, or you might feel other sensations come through. And that's where, an actual massage or deeper work or, exercises would be definitely applicable in those situations.
So, Griselle, I want to thank you for a lot of, I think, really useful, applicable, easy to put into place kinds of tips, both to start our day, which I think of a little bit more as kind of preventive maintenance. That might be just my mindset, um, as well as things that we can do to release tension in the course of the day, especially as we're sitting at our desks and notice things getting uncomfortable.